Appendicitis. Appendicitis is the inflammation or infection of the appendix. Organ or worm-like structure. At the beginning of caecum. This is the structure of appendix as you can see in this picture. Important features. Length 7 to 15 centimeters. Width 0.5 to 1.5 centimeters. It is vestigial organ. Location of appendix. It is accessed by Mcburney's point. Anterior part of pelvic bone and umbilicus is present Mcburney's point. Present on lower right side. This is the histology of appendix structure. This is the internal detailed structure of appendix as shown clearly. Numerous goblet cells. Secrete a lot of mucus. It has lymphatic tissue and nodules. Two structural layers of appendix. Muscular layer outer longitudinal. Inner circular layer. In this picture, you can clearly see 6 positions of appendix at different clocks in which it can. Causes of appendicitis. Also, by Fecolith. Foreign body. Inflammatory bowel disease. Crohn's disease. Ulcerative. Trauma. This is chart that explains how appendicitis occurs in easy language. Signs and symptoms. Symptoms. Guarding. Rebound tenderness. Rovsin sign. Aoron signs. We also do different tests. Psoas test. Obturator test. Signs. Pain at Mcburney's point. Nausea and vomiting. Abdominal swelling. Patient feel pain in passing urine. Phases. Types. Visceral. Pain around umbilicus. Somatic. In appendix at left quadrant region of abdomen. Clinical signs. Anorexia. Pain in epigastric region. Umbilical lower quadrant region. Fever. Leukocytosis. Bacterial infection. Analysis. Lab. Instrumental. Leukocytosis. C-react protein. IL-6. Bilirubin. Urine analysis. X-ray. Fluid. Differential diagnosis. Acute mesenteric odinitis. Pelvic inflammation. Gastroenteritis. Meckel diverticular. Crohn's disease. There are two treatment methods of appendicitis: laparoscopy, appendectomy. Complications. Perforation. Preappendicular abscess.